I'm Dr. Ann Rainville, and I'm a gynecologist here at Physicians Regional Medical Group, and I specialize in the treatment of a full range of gynecological problems, which I will discuss briefly. There are a lot of misconceptions in terms of what really a hysterectomy is. A hysterectomy is the removal of the uterus, the womb, basically where a pregnancy grows, so the uterus and the cervix. That is all a hysterectomy is removing, is the uterus and the cervix. A lot of women are concerned when the discussion is made with having a hysterectomy that it would affect their hormones. What's very important is to understand is that a hysterectomy alone is just removal of the uterus and the cervix and does not affect a woman's hormones at all. So if a woman has a condition which is affecting her life adversely and is, something that makes her think she might want to have a hysterectomy for it, she does not need to worry about the possibility of it putting her into early menopause or changing her hormones. And I think that that's really important for women to understand. So why do women have hysterectomies? Most often, the reason why women have hysterectomies is because of abnormal bleeding problems with their uterus. Unfortunately, as women, you don't even have to be in middle age or older to have problems with abnormal heavy bleeding. There are many ways where heavy and abnormal uterine bleeding can be treated without the need for a major surgical procedure as a hysterectomy, but sometimes those procedures are not effective or just, your condition may not really be able to be treated that way. So if more sort of outpatient, more medical management or outpatient type of procedures for abnormal bleeding cannot be done, then the plan and the choice may be to go ahead with a hysterectomy. Again, why to have a hysterectomy is because you personally have symptoms that affect your life significantly enough that it is warranted to have a hysterectomy. That is the reason to have it. The other most common reason for a hysterectomy is fibroids. Kind of ties in with abnormal bleeding. Fibroids by themselves don't always cause abnormal bleeding, but sometimes they do. Uterine fibroids are benign muscle tumors of the uterus that can cause abnormal bleeding. Again, a very good reason for a woman to consider having a hysterectomy. The last reason, most common benign reason, what we talk about non-cancerous type of reason to have a hysterectomy, is for endometriosis. Endometriosis is a common and benign gynecological condition that can cause a wide variety of very unpleasant symptoms, including heavy and abnormal bleeding. And again, a hysterectomy can be done for that. Of course, it's important to realize that if one has a hysterectomy, that means that you would never be able to bear a child. So women have to be done with their childbearing, no longer want to have any children before consideration of a hysterectomy. Lastly, the thing I want to discuss is how hysterectomies are done. Hysterectomies can be done with a major abdominal type procedure that requires an inpatient stay and a 6-week recovery. That is not the way that I do most of my hysterectomies. Most of my hysterectomies that I do are done with what's called a minimally invasive surgical procedure, which is done with a combination of laparoscopy and vaginal surgery, which can even be done as an outpatient where you can go home the same day. Recovery time is truly, should still be considered 4 to 6 weeks in terms of full recovery, but you can return to most of your activities in 3 weeks.